Okay, good afternoon, everybody. Thank you so much for taking the time to be here. As many of you know, I have spent the past 20 years of my life, since my life with cancer began, working with cancer patients who have a tough time accessing the health care they need. I've spent a great deal of time looking at how we might improve that access for every citizen in Jacksonville. Good health is one of the pillars of my campaign for mayor, and frankly, it is the backbone of economic prosperity and quality of life. In a recent survey, Jacksonville residents listed health as the #1 driver of their quality of life, and nothing else came close. Here's the reality in Jacksonville. We have some of the finest medical institutions in the country right here in our city. Yet we are the only major metropolitan area in Florida to rank in the bottom half of health outcomes on multiple fronts. Obesity and diabetes rates are 18% higher than the state average. Premature death, 36% higher. Drug overdose deaths due to addiction, 66% above the state average. And listen to this, our child mortality rate, a whopping 80% higher than the national average. We have many wonderful organizations who try to make a dent in these disturbing numbers, but we've left them without the support they need for maximum impact. The bureaucracy for services is astounding for both patients and providers, and there is an inefficient use of city dollars due to a lack of coordination of those services. Our city does not apply for many federal, state, and private grants, and we have not taken a leadership role in leveraging available programs. I aim to change all of that when I become mayor. When I started to look at how to craft this policy, I went right to the source. Doctors and other health professionals who witness our health access barriers firsthand. I'm grateful to have some of those doctors here with me today. Our Good Health Plan has 4 initiatives which I believe, once implemented, can radically improve health outcomes in our city, decrease disparities in access to health care and inequities in health outcomes, and help us prepare for future emergencies, including pandemics, hurricanes, and climate change. I'm going to highlight each of those, and then I'm going to ask this esteemed group of doctors to come up and tell you more about that plan, because they were really the architects of it. First of all, I will appoint a chief health officer. This will be a physician. That doctor's job will be to make Jacksonville's health a top priority and make sure our city is the best partner for local healthcare entities, both public and private. Will also hold us accountable for how city dollars are spent on healthcare, which right now we really don't do a very good job of. Second, we will provide enhanced support for the nonprofit and philanthropic efforts working toward improving our health. Third, I will create a health-specific communications team to ensure needed education and information gets to the community. This has not been a priority. And finally, I will fight for the city of Jacksonville when it comes to home rule and funding for health, which has been absolutely decimated at the state level. To address each of these initiatives, I'd like to introduce 3 doctors who are no doubt familiar to many of you and who have been working to improve health outcomes in our city for a very long time. They have been instrumental in crafting this policy. I'm going to introduce each of them, and then I'm going to have them come up and speak with you. First of all, Dr. Rogers Kane. Dr. Rogers Kane is the president of the Northeast Florida Medical Society Foundation and has been practicing as a family physician in the North Side for 30 years. During his entire career, he has provided leadership in the community to improve access to care and to reduce health disparities in the city of Jacksonville and in the state of Florida. Dr. Jeffrey Goldhagen. Dr. Goldhagen is a professor of pediatrics at the University of Florida. He has served in Jacksonville and has served as the director of the Duval County Health Department for almost 15 years. He serves as the president of the International Society of Pediatrics and has been heavily involved in advancing the health of the Jacksonville community for 30 years. And last but certainly not least, Dr. Sunil Joshi. Dr. Joshi is an allergist, immunologist who was born and raised in Jacksonville and is passionate about the health of our community. He has most recently been involved in programs to increase flu vaccination rates and to prevent physician burnout. So let's start with Dr. Goldhagen, and then I'll let each doctor come up and talk with you, and then you can ask me any questions you like or them, okay? Thank you.